Hi, I am Dr. Batra. Today we'll talk about something called carpal tunnel syndrome. So I have a model of the hand and the wrist. So if you can appreciate, this is the front side, this is the back side, okay? And on the front side, on the front of our palm, we have something called the transverse carpal ligament, which is a thick band-like structure below which all the important structures which supply the hand go. Okay, so when this ligament becomes tight, that causes pressure on these important structures. One of the important structures in that area is the median nerve. So, a nerve which goes in the wrist and supplies the thumb and these two fingers and half of this finger, the ring finger. So, when that is pressed, clinically we call it carpal tunnel syndrome. I'll just go through the notes so we don't miss any points. Okay. So, okay, how does carpal tunnel syndrome present? So, there will be tingling, numbness over these three fingers, sometimes even the ring finger. There will be pain. Classically, what happens is in the night you will wake up, you'll feel like your hand has gone numb and you'll have to wring it and just throw it around, and then you'll feel the blood circulation coming back. And that breaking of sleep is a very common scene, especially in the later stages. As the disease progresses, because the nerve supplies the muscles, your hands might feel clumsy, you might drop stuff, doing fine movement, closing buttons, you might feel you're not coordinated enough. So, there's a general sense of feeling of clumsiness in the hands. As the disease progresses further, you'll feel the muscles waste. Waste means you see this bulge, this is called the thenar eminence. So, this will start to flatten out. So, the palm seems less muscular. That is because the nerve supply to the muscle is getting wasted, stopped. So, that is causing the muscle to get wasted. Now, why does it happen? So, most common reason, repetitive use of the wrist in a flexed position, typing in a wrong position. It can be because of factory workers, cooks, anything where you are excessively using wrist in a flexed position. This can happen, and that is the reason in the night also it worsens, because when we are sleeping our wrist tends to go in a flexed position. It is common in pregnant ladies, post pregnancy it's very common. Why that happens? Because of the hormonal changes, there is fluid retention which puts pressure on the components in that area. Diabetics, thyroid patients, rheumatoid arthritis patients, obesity for obvious reasons, and it's actually 3 times more common in females than males. How do we diagnose it? We have some clinical tests we'll do on you, like keeping your wrist in a flexed position and seeing if we can recreate those numbness things. Then there is something called the Tunnel sign, where we just tap your wrist over the nerve and you'll feel that numbness or tingling going in the fingers. If we feel it is warranted, we will also advise something called a nerve test. What that does is it checks the health of the nerve and helps us compartmentalize carpal tunnel syndrome into mild, moderate and severe. So, what are the treatment options we have? Like I said, when the wrist is in flexed position, that causes pressure over the nerve, that will cause recreation of the symptoms. So, we advise night splints, which keep your wrist in neutral or slightly extended position, which will prevent this from happening. 80% of patients with mild cases respond to night splinting. So, that is the first thing we do. So, even you can do it straight away if you have had recent symptoms. We give some anti-inflammatory medications for obvious reasons. That is, there is inflammation which is causing swelling of the soft tissues. So, anti-inflammatory medicines will help in that. There is a role of steroid injections, where we inject steroid in that area next to the nerve. How effective it is? There is a 70 to 80% short-term relief. Recurrence can happen in 3 to 6 months, but if it works well, it works very well. We can advise physiotherapy, we can advise some therapeutic ultrasound things, but these are all symptomatic rather than anything else. Okay. Now, what do we do? Other options we have, if nothing is working, then we just advise for surgery. What do we do in the surgery? Okay, like I said, there is a band which is and there is soft tissue swelling, so this band needs to be released surgically. How do we release it? We put a small cut on the palm, we go carefully and we release the band while protecting the nerve and the important structures below that band. We can do it through an open procedure, or we can do it through a endoscopic procedure, which is like a keyhole surgery. Long-term studies have been done and have shown that surgery is effective almost 90% of the times and is a good option if everything else has failed. Okay, so that's all about carpal tunnel syndrome, and if any questions, let me know in the messages. Thank you. Stop recording.